What if I told you that a system weighing less than 100 grams total controls literally every function in your patient's body, and when it fails, it can kill them in hours? The endocrine system produces over 50 different hormones that regulate everything from your patient's heart rate to their blood sugar to whether you survive a code blue. And here's the terrifying part: endocrine emergencies are often missed until your patient is already crashing because the symptoms look like everything else. My name is Neil Brian Galvey, and this is NurseBrain, where we give you the confidence to succeed in critical care by breaking down complex topics that can literally save lives. If you want to be a nurse who catches the subtle signs that others miss, make sure you subscribe and hit that bell icon right now. Here's what most healthcare professionals don't realize about the endocrine system. It's not just about diabetes and thyroid problems. This system is your body's chemical messenger network, and when it goes wrong, it affects every single organ system simultaneously. We're talking about life-threatening emergencies like diabetic ketoacidosis, thyroid storm, and adrenal crisis that can kill your patient faster than a massive MI. In this lesson, I'm going to break down the endocrine system in a way that will completely change how you assess your critically ill patients. First, I'll show you how this invisible network of glands controls everything from your patient's ability to respond to stress to their basic metabolism. Then, I'll walk you through the major endocrine organs and the hormones that can make or break your patient's survival. And finally, I'll give you the clinical recognition patterns for the endocrine emergencies that you absolutely cannot miss. But first, let me tell you something that's going to blow your mind about how powerful these tiny chemical messengers really are. Picture this: your patient's endocrine system is like the internet of the human body. Instead of electrical signals like the nervous system, it uses chemical messengers called hormones that travels through the bloodstream to target specific cells and organs. And just like the internet, when this communication network goes down, everything stops working properly. Here's what makes the endocrine system absolutely critical in the ICU. It controls 9 essential functions that determine whether your patient lives or dies. Water and electrolyte balance, your patient's sodium, potassium, and calcium levels, growth and metabolism, how their body uses energy and maintains temperature, heart rate and blood pressure management, their cardiovascular response to stress, immune system control, their ability to fight infection, blood glucose regulation, preventing both hypoglycemic coma and diabetic ketoacidosis. But here's the part that will change how you think about critical care forever. The endocrine system doesn't just maintain normal function, it's your patient's primary survival mechanism during stress, trauma, and illness. When your patient is in the ICU, their endocrine system is working overtime to keep them alive. Think about it. When your patient goes into shock, what happens? Their adrenal glands dump epinephrine and norepinephrine into their bloodstream. Heart rate increases, blood pressure rises, glucose is released for energy. That's not the cardiovascular system responding, that's the endocrine system saving their life. And here's the critical part that most nurses miss. Very small amounts of hormones can trigger massive physiological changes. We're talking about nanograms and picograms of substances that can mean the difference between your patient compensating and your patient coding. That's why endocrine emergencies can escalate so quickly and why early recognition is absolutely everything. Now, let's break down the major players in this system, because understanding these organs and their hormones is going to help you recognize when things are going wrong before your patient crashes. Start at the top, the hypothalamus and pituitary gland. Think of these as mission control. The hypothalamus produces releasing hormones that tell the pituitary what to do. The pituitary then releases hormones that control other endocrine glands throughout the body. When this system fails, you get conditions like diabetes insipidus, where your patient can lose liters of fluid per hour. The thyroid gland, This butterfly-shaped gland in the neck controls your patient's metabolic rate. Thyroid hormone determines how fast every cell in their body burns energy. Too much and they get a thyroid storm, hyperthermia, tachycardia, and cardiovascular collapse. Too little and you get mixed edema coma, hypothermia, bradycardia, and respiratory failure. The adrenal glands, these triangle-shaped glands sitting on top of the kidneys, are your patient's stress response headquarters. The adrenal cortex produces cortisol, your body's natural steroid that helps you survive stress. The adrenal medulla produces epinephrine and norepinephrine, your fight or flight hormones. When these fail, you get adrenal crisis, profound hypotension that doesn't respond to fluids or pressors. The pancreas, specifically the islets of Langerhans. Beta cells produce insulin. Alpha cells produce glucagon. This is your blood sugar control center. When this system fails, you get diabetic ketoacidosis or hyperosmolar hyperglycemic state, both potentially fatal if not recognized early. But here's what makes endocrine systems so challenging in the ICU. These organs don't work in isolation. They're constantly communicating with each other through feedback loops. When one system fails, it affects all the others. For example, your septic patient isn't just fighting infection. Their adrenal glands are pumping out cortisol to help them survive the stress. Their pancreas is releasing glucose to fuel the immune system or the immune response. Their thyroid is ramping up metabolism to support increased cellular activity. It's a coordinated response, and when any part of it fails, the whole system can collapse. And here's the part that will make you a better critical care nurse. You need to think about endocrine function in every patient, not just the ones with obvious endocrine diseases. That post-op patient who's not waking up appropriately could be adrenal insufficiency. That trauma patient with persistent hypotension despite adequate resuscitation could be relative adrenal insufficiency from the stress response. Alright, now let's talk about the endocrine emergencies that can kill your patient if you don't recognize them early. These are the conditions that often masquerade as other problems, leading to delayed diagnosis and increased mortality. Diabetic ketoacidosis, DKA. This isn't just high blood sugar. Your patient is in state of starvation at the cellular level despite having glucose in their blood. Without insulin, cells can use glucose, so they start breaking down fat for energy. This produces ketones, which are acidic, classic triad, hyperglycemia over 250, ketones in blood or urine, and metabolic acidosis with pH less than 7.3. But here's what kills patients. It's not the high glucose, it's the dehydration and electrolyte imbalances. These patients can be down 5 to 10 liters of fluid and have severe potassium depletion despite normal or high serum potassium levels. Thyroid storm. This is hyperthyroidism on steroids. Your patient's metabolism is in overdrive, heart rate over 140, temperature over 101, altered mental status, and cardiovascular instability. The mortality rate is 20 to 30% even with treatment. The trigger is often infection, surgery, or discontinuation of anti-thyroid medications. What makes this deadly is that it looks like sepsis initially, high fever, tachycardia, altered mental status. But if you treat like it's sepsis without addressing the thyroid component, your patient will die. Adrenal crisis. This is what happens when your patient's adrenal glands can't produce enough cortisol to handle stress. Profound hypotension that doesn't respond to fluid or pressors. Nausea, vomiting, altered mental status, or hyperkalemia. The classic scenario is a patient on chronic steroids who gets sick and doesn't increase their dose. But here's the tricky part. Any critically ill patient can develop relative adrenal insufficiency. The adrenal glands just can't keep up with the stress of critical illness. That's why we sometimes give stress dose steroids to septic shock patients who aren't responding to standard treatment. Hyperosmolar hyperglycemic state, HHS. This is the other diabetic emergency that's actually more deadly than DKA. Glucose levels over 600, severe dehydration, but no ketosis. These patients are often older and the onset is more gradual. The mortality rate is higher than DKA because the diagnosis is often delayed. Here's what you need to understand about all of these conditions. They're medical emergencies that require immediate recognition and treatment. Delay diagnosis by even a few hours, and your patient's chance of survival drops significantly. But catch them early, and most patients do well with appropriate treatment. Now, let's talk about how you actually assess endocrine function in your critically ill patients, because this is where you can make the difference between early recognition and missed diagnosis. Your systematic endocrine system starts with the basics but goes deeper. Vital signs with a twist. Don't just look at the numbers, look at the patterns. Persistent tachycardia despite adequate pain control and normal temperature. Think hyperthyroidism, hypotension that doesn't respond to fluids. Think adrenal insufficiency. Temperature instability could be thyroid dysfunction. Mental status changes. This is huge in endocrine disorders. Confusion, agitation, or decreased level of consciousness can be your first sign of severe hypoglycemia, diabetic emergencies, thyroid dysfunction, or adrenal crisis. Don't just assume it's ICU delirium. Fluid and electrolyte balance. Endocrine disorders cause massive fluid and electrolyte shifts. Severe dehydration with high glucose, think DKA or HHS. Hyponatremia with volume depletion, think adrenal insufficiency. Polyuria with high sodium, think diabetes insipidus. Laboratory trends. Don't wait for the endocrinologist to order the right tests. If you suspect an endocrine emergency, you need glucose, electrolytes, arterial blood gas, and specific hormone levels. For DKA, you need ketones. For a thyroid storm, you need TSH and free T4. For adrenal crisis, you need cortisol levels. But here's the most important thing. Don't wait for the lab confirmation to start treatment if you have a high clinical suspicion. Thyroid storm? Start anti-thyroid medications and beta blockers. Suspected adrenal crisis? Give stress dose steroids. DKA? Start insulin and fluid resuscitation. And here's something that will make you better nurse. Think about endocrine function in the context of your patient's overall condition. That post-surgical patient who's not recovering as expected could have undiagnosed diabetes or adrenal insufficiency. That trauma patient with persistent metabolic acidosis could be developing stress-induced diabetes. The good news is that most endocrine emergencies are very treatable when caught early. DKA patients can go from comatose to awake and talking within hours of appropriate treatment. Thyroid storm patients can stabilize quickly with the right medications. Adrenal crisis responds dramatically to steroid replacement. Let me wrap this up with the key points that could save your patient's life tomorrow. Number 1. The endocrine system controls every vital function in your patient's body through chemical messengers called hormones. When the system fails, it affects multiple organ systems simultaneously. Number 2. Endocrine emergencies often masquerade as other conditions. DKA and HHS look like dehydration and infection. Thyroid storm looks like sepsis. Adrenal crisis looks like refractory shock. Number 3. Early recognition is everything. These conditions can kill quickly, but they're very treatable when caught early. Don't wait for lab confirmation if you have high clinical suspicion. Number 4. Think endocrine in every critically ill patient. Stress, surgery, infection, and critical illness all put massive demands on the endocrine system. Any patient can develop endocrine dysfunction. You now understand how this invisible network of glands and hormones controls your patient's survival. You know the major endocrine emergencies and how to recognize them early. And you have the assessment skills to catch endocrine dysfunction before it becomes life-threatening. That knowledge makes you the nurse who doesn't just treat symptoms. You identify and treat the underlying endocrine causes that others miss. If this lesson changed how you think about the endocrine system and critical care, hit that like button. It helps other nurses discover this life-saving content. Share this with any nurse who needs to master endocrine assessment and emergency recognition. Make sure you subscribe for more critical care education that will make you the nurse everyone turns to for complex patients. And check out my lesson on fluid and electrolyte management that I'm linking right here. It perfectly complements everything we've covered about endocrine function today. As always, Thank you for watching, and remember, understanding the endocrine system isn't just about hormones, it's about understanding how your patient's body fights to survive. I'll see you in the next lesson. Once again, this is NurseBrain, inspiring greatness one lesson at a time.